recording.
Yep, it's recording.
Okay, good afternoon, everybody. Welcome to the NIGMS IDeA-wide town hall meeting. My name is Gus Kusulas. I'm the NAIPI president. As you know, NAIPI stands for National Association of IDEA Principal Investigators. Members of NAIPI are not only the principal investigators of the different programs. We have now 4 different categories of programs: the COBRIs, IMBRIs, the entrepreneurship hubs, and the translational centers. And as you notice, the NAIPI symbol has now changed from 3 interwound circles to 4 of them, depicting these 4 different programs. The NAIPI is the organization, which is not-for-profit organization, to promote biomedical research in 23 states and Puerto Rico. The NAIPI has an executive committee, for which I'm the president. We have Scott Seville from Wyoming as the vice president, Ian Meng from Maine as the treasurer, Julie Oxford from Idaho as the secretary. We also, Doug Wright from Kansas is the past president, serving the executive committee. And Caroline Bohans is leads a working group on membership, any issues related to membership. The NAIPI has a brand new website that you've seen in front of you. It's still under construction. We envision that a lot of the information about the NAIPI and all of the 23 states and Puerto Rico activities will be ultimately linked to this website through automated mechanisms to download news and views. I wanted to tell you very briefly that NAIPI takes an active role in promoting biomedical research throughout all regions. For the first time, we're going to be awarding CAS awards and certificates to all 3 regions, regional meetings for undergraduates, graduate students, and junior faculty members at the level of $200 per CAS award for each one, as well as a nice certificate from NAIPI for biomedical research excellence. We're also going to provide an additional set of benefits that you can see if you look at the website. Under the little human being symbol on the far right, you're going to see some of the benefits that NAIPI is planning to provide that are listed here, including travel funds to Washington, D.C., funding undergraduate, as indicated the awards, having access to databases for research expertise, and potentially providing discounts for virtual courses in data science and bioinformatics, as well as a job posting, job searches for the IDEA network that we're planning to launch in the near future. So the NAIPI also has a steering committee composed of 5 members from each region, 20 members total. The elections for the new steering committee members has been completed, and we have a brand new set of 20 members that really help us guide of where NAIPI is going. So today we are very pleased to have the director of the IDEA program, and you see his short bio sketch that's posted in the email. Dr. Ming Lei has joined the IDEA program, and he has really, in his short time with the program, has excelled in leading this program and creating new opportunities for the IDEA investigators throughout the 23 states in Puerto Rico. So we're very pleased to have Dr. Lei give us the keynote address, give us a briefing on the IDEA progress on this point. And thank you, Dr. Lei, for attending this meeting. I will then revert to you to start your presentation.
Thank you, Gus. Let me see. Okay. That should be. Do I have the control yet?
Yeah, you should be able to control.
Okay, let me find my to share slides.
Would you like me to share them?
I don't see the share slides thing. Or maybe it's down here.
Here it is. I see it now.
Okay, all right. So you're controlling it, right?
Yes, I am.
That's fine. Okay. Thank you guys for organizing this event. The pandemic took away our national conference last summer in DC. So I really appreciate this opportunity to connect with the leaders of IDEA program as a group. I'll give a short presentation. Hopefully I'll try to wrap it up within half hour and spend the rest of the time hearing your feedback and answering your questions. And before I start, I would like to thank Doug White for his service and leadership in the past few years, and congratulate Gus for ascending to this prestigious position again. This is Gus' second tour as president of NAIPI, speak volume of his dedication to the program and willingness to serve. And I look forward to working with you, Gus. Next slide, please. So I'm going to cover 3 topics, give you a sort of a short report of the overall program as where we are, where things stand. And I'll spend some time talking about the activities by the program and the community in response to COVID-19. And I will wrap up by highlighting a few upcoming opportunities for all of you. Next, please. So we continue to enjoy generous support from the Congress. The current fiscal year, the budget is just about $400 million. And you can see that over the 9 years since the IDEA program moved to NIGMS, the budget has increased more than 40%. Compared to the NIH budget is always slightly below the 1% of the overall NIH budget. So the congressional support has been generous and steady. Next, please. With this slightly below 1% of budget, however, the IDEA fund represent about 20% of the NIH funding the IDEA state get. So obviously different state, the situation is slightly different. Look at the red color on this slide. You can see in some state, IDEA funding represent about 9%, that's Kentucky. And in other states, the number is way higher, it could be more than 60%. So simply looking at the numbers, I think it's fair to say that the IDEA program and IDEA funding plays a critical role for biomedical research in IDEA states. Next slide, please. So with this support, the IDEA program support 5 funding programs. Although Gus mentioned that there are 4 sectors in the NAIPI association, but we do support the co-funding, as I'm going to briefly touch on. So to this audience, I don't need to go through the details of the 5 funding programs. That's COBRI, IMBRI, IDEA-CTR, co-funding, and Sttr hubs. Instead, I'll just give you, for each program, 1 or 2 things that are new in the last couple of years. Next. So for COBRI, I want you to know that during the challenging time of the pandemic, so we encouraged programs to use the COBRI fund for new faculty hiring, and also provide flexibility for the required 3 minimal research project leaders during the pandemic. Next, please. For IMBRI, we have started a collaboration with Google and Amazon, leveraging the powerful network of IMBRIs, which I'm going to talk about a little bit later. Next. For IDEA-CTR, we recently reissued a new funding opportunity announcement clarifying that the IDEA Sttr is a statewide or regional network. The infrastructure is not to one or a few institutions, is a statewide or regional resource to serve, to build clinical translational research capacity that's serving the state or region, all people. Next. And for co-funding, that's a very popular program because it basically allows us to come in to rescue a few meritorious R1 or R15 applications the other NIH institute would not fund. So recently we required every NIH IC to appoint a co-funding coordinator, and you can find their contact information on our website. Hopefully this will facilitate the program. And finally, next. For the Accelerator Hub, when it started, it did not fund pilot project. Since last year, the Hub started to fund pilot project, and also the IDEA program together actually support more than 300 technology cores. So we started last year to fund to support a business fundamental for technology core directors course. So hopefully that effort will enable or strengthen the technology course sustainability in the long haul. Next, please. While the 5 funding program build very strong platforms, if we build them as pillars, they also offer us opportunities to leverage a lot of other resources and opportunities and to generate synergies. The first thing we emphasized, started a few years ago, is to actually, when we observe that as the IDEA program grow, different funding programs actually to start silos on their own. So we started a collaboration program really to give the IMBRI program supplement specifically for collaborations among IDEA programs, meaning IMBRIs with COBRIs, with CTRs, and this year we added the IDEA co-funded principal investigators as eligible collaborators. We also leveraged the IDEA program to build collaborations with other NIH programs so that we can bring in more resources to the IDEA state. So many of you have received the maternal and infant maternity research supplement last year, and we're doing that this year again. This is basically support IDEA investigators research in this particular area by other NIH ICs. In other words, by non-IDEA allocations. And we started IDEA state COVID-19 patient registry, very much leverage the resource by NCAT and NIH's Office of Data Science Strategy, which I'm going to discuss a little bit later. And also, we started, as I mentioned, a collaboration with Google and Amazon to bring cloud computing to IDEA state, or to strengthen the biomedical research using cloud computing in IDEA state. And finally, this the IDEA program, because the wonderful work you guys do, also provide us the strong opportunity to compete for other NIH funding programs, funding opportunities. The good examples are the funding programs sponsored by NIH during the pandemic, which I'm going to discuss a little bit as well. So next, please. So together, just want to give you an overall vision, so to speak, the core funding programs, as well as our effort in building collaborations and competing in other NIH opportunities, are 2 quadrants that together will serve the IDEA state in basic translation on the clinical research in all the IDEA states. So next, please. Next, I'm going to switch gear to talk about the community's effort and achievement during the COVID-19. So this is a special year. So I'm going to talk about 3 sets of activities. Next, please. The first one is a standing up of the IDEA State COVID-19 patient registry. So early on during the pandemic, we recognized the importance of capture the patient record in understanding the pandemic and the potentially address the obvious disparity during the COVID-19 pandemic. So precisely about a year ago, we published a funding opportunity announcement to support COVID-19 patient registry. And within one short year, the application was submitted. We built a collaboration with NCAT, as I mentioned. And under the very, very strong leadership of Dr. Sally Hodder, the IDEA CTRs formed a coalition with 8 sites and assembled a very large volume of data, harmonized and put in cloud computing infrastructure. And while we call it a registry, actually it's more than a registry, because this site enables clinical investigators to utilize the data to conduct research. So as of now, all 8 sites have contributed data and deposited into the data warehouse, as I just mentioned. Next, please. And the data from IDEA State is very diverse, especially there's a lot of rural patients in this data collection. You can see that from all 8 IDEA CTRs, there are significant number of minorities, Black, Latinos, and the rural population is particularly high, and also the American Indians. So together, more than 13 million EHR data are recorded, and with more than 2 million tested patients and more than 200,000 positive cases deposited into the data warehouse. Next, please. And during this time, as I mentioned, we built a strong collaboration with NCAT. So the IDEA CTRs, together with the 60 CTSA sites supported by NCAT, contributed to this National COVID Cohort Collaborative data warehouse that I have EHR record, including various treatment and outcomes. So this is a very powerful data cohort for clinical study investigations, and also obviously put IDEA CTRs or IDEA programs on the map of a national program. Next, please. So from this point on, where we go with this registry, so we just issued another FOA to expand the registry in both in terms of data volume and possibly data types. At this point, the data are EHR data, but there are other useful data. For example, as I'm going to briefly touch on, the viral genome sequence, for example, the various different variants that becomes critically important for controlling the pandemic. And also this data set provide a very strong foundation to leverage or to grow, develop into the post-acute phase COVID-19 studies. And our IDEA CTR coalition actually has put forward a big application to another NIH program to compete for that resource. Next, please. During the pandemic, NIH, together with the Government Office of Work Speed, sponsored a large cohort of clinical trials. Those are called Accelerating COVID-19 Therapeutics Intervention and Vaccines Trials. And a key point for trials like this during a public health crisis is to rapidly leverage existing capacity or resources to implement in the trials. The organizers reached out to certain IDEA state site at the beginning, but when Dr. Collins realized that there are big holes in the country that need more sites to join in, we stepped up and helped mobilize a large number of IDEA state sites to participate in these trials. And you can see this map in almost all the IDEA states. I probably missed a few simply because we weren't able to collect, have participated in various active trials. And while the outcome is wait to be known, one thing we know for sure is Dr. Collins was very, very pleased and actually very impressed by how rapidly that IDEA program can step to the plate. Next slide, please. And the next set of activity I want to share is that the participation of IDEA program or IDEA investigators in the NIH-sponsored RADIX Rapid Acceleration of Diagnostic Initiative. One of the, as you all know, the pandemic hit the minorities or other underserved populations particularly hard, and the disparity is the greatest concern, and it also is greatest key point in control the pandemic. So NIH launched a $500 million initiative to accelerate testing in underserved populations. The goal of the program obviously is to enhance and broaden the testing among underserved and vulnerable populations. For example, including vulnerable populations, including elderly in nursing homes. And the major approach for this approach is to develop a consortium of a community engaged research project for rapid implementation of test interventions, and also to collect the testing data so that to help the understanding of the disparity in infection, disease progression and outcome, and hopefully to identify and help inform the development of strategies to reduce disparity. So we divided the $500 million into two phases, anticipating it's a sort of a long haul in addressing this crisis. Phase one was launched, meaning the awards have been issued in last year. So we spent about $300 million that funded 69 research awards, plus an $80 million coordinating center that will be support both phases. Next, please. So as I mentioned, NIH-wide, there are 69 awards. I'm very, very proud to share with you that the IDEA community made very significant contributions to this effort. Among the 69, 8 of them are from our grantees. I don't mean for you to read this list, but you can see that we got 8 out of the 69 NIH-wide, and those are 2-year awards serving our communities. And you can see that from the column on the right are pretty large awards ranging from $1.5 million to $5 million in 2 years. So this is a very, very impressive accomplishment. Next, please. So to summarizing the IDEA community's effort and contribution, so we did my office did a sort of counting of the COVID-19 related publications by IDEA grantees. So by no means this is a complete counting, but we identified 164 unique publications by IDEA grantees in the past 2 years. I think this is a very, very impressive number. And out of the 164, 76 of them are peer-reviewed research articles. So represent, again, highlight what I said earlier, that the IDEA program and IDEA community are significant critical contributors to the biomedical research, not only in IDEA state, in the nation in this regard. Next slide, please. So I hope you're all aware that we have recently issued two specific funding opportunity announcement that target two critical aspects of the pandemic. One is the SARS-CoV surveillance studies to identify variants, the genomes. So this applications have been received and reviewed. A few of you probably have already received the award. So we hope altogether I can share with you, we're going to have a $15 million investment in this regard. Hopefully, again, the IDEA community will make a significant contribution to the control of the pandemic. And you all know, in the US, the overall effort on viral genome surveillance or tracking is not optimal, is behind many other countries. And IDEA program, I think, is the one that issued this FOA with, the only one issued this FOA with a singular focus in this regard. The next one is also a supplement funding opportunity that specifically address vaccine hesitancy in our communities. I think in many pockets of the population suffer from severe vaccine hesitancies. So we'll have a set of awards to help address this issue. Next, please. So I'm going to, again, to switch gear to highlight a few opportunities that I hope you all will consider and compete and contribute. Next, please. So I mentioned the RADIX Hub phase 1, and now we are in phase 2. So there are 5 funding opportunity announcements in phase 2. One of them focused on school, return to school issues that was led by the Child Health Institute. That one application has been completed. The more relevant to our community are those 4. The first one is administrative supplement to the RADIX phase 1 grantees. That, again, the application has been closed, but the other 3 are still on the market, on the street, okay? There are 2 of them, the middle 2, all focused on testing still. And the difference between those 2, one is for competitive revisions, meaning all current NIH grantees, which most of you are eligible to apply. For this one, the budget is $2.25 million for 2 years. So the direct cost is $750 per year. And the deadline is coming soon, end of this week. But if you can't make that one, the next one is open to everyone, right? So that one, there is a possibility that you can request for higher budget if you build a partnership. So that one, the submission due date is July the 7th, okay? There's still quite a bit of time. And the last one is also for new grant, for new awards, focused on the social ethic implications, okay? So I understand that this is a challenging time. The academic investigators, I understand, somehow find a way to make yourself even busier during this time. So everybody is tired. There's a fatigue around, but those are still fantastic opportunities. So again, as I mentioned, those are for 2-year award. Could be, the budget could be up to $5 million. And so take a look at those. Next slide, please. The next set of opportunity is, as I mentioned, that one of our long-term goals is really to bring the cloud computing to institutions that don't necessarily have the financial means like the well-established institutions, let's say like Harvard, right? Because computing used to require very heavy upfront investment. However, cloud computing enable us to find different ways to bring the resource to smaller institutions, to undergraduate. The way to do that is to leverage service providers such as Google Cloud and Amazon Web Services. So we have, through the NIH Stride initiative, we have built a partnership starting with 2 sets of programs. One is focused on research. So AWS, that's the Amazon program, launched 2 programs to basically encourage investigators to use the cloud computing service for their research, right? Anybody can submit an application to Amazon, and they will provide the service. And for our program, and we had an agreement or deal with them, they allocated $250,000 to each of those 2 research programs, that if you put your application marketed NIGMS supported program, they will give you a discount. Exactly how much, that's up to you, your application discussion with them. All right. So I know that a number of our investigators have actually on their own initiated cloud computing usage. So I think there is a need for this. I encourage you to look into that. Now, this program is till the end of this year. What happened after this year? So our agreement with Google and Amazon is that they charge investigators pretty much by your cloud computing time, right? By how much time you use. So if you continue to use their service after the year, and you still tell them your IDEA supported investigators, you will get a discount in that cloud computing time. Okay, so many of you, if you pay attention to the email or the Monday afternoon, the weekly update, you probably read the message, but I want to highlight this again to you. Next slide, please. And we also collaborated Google and the AWS to provide basic cloud computing training, because after all, we are biomedical researchers. So many of us don't even know what cloud computing is. So we have agreement with them. They're going to provide 500 training, up to 500 training days for our student investigators at 3 different levels: beginner, intermediate, and advanced. So I'm pleased to share that the first 2 classes, one on June 4th, another one on June 7th. Those are all whole day classes, have been filled with 20 participants from our programs. In this case, as I mentioned, we started with Embrace because Embrace has been, I would say, pioneer in this regard. Each Embrace has a data science core, right? So you have a platform kickstart this effort. So there will be, pay attention to the communications we send out. During the summer, there will be more course offering, and there will be more slots available to sign up. And after, what happened after this 500 free training? So we are also engaging an effort to build this kind of sandbox, basically self-learning. So hopefully by the late fall, we can launch the sandbox so that our investigators and the student can log on the sandbox and the learning through doing, bring your own research project and leverage the basic cloud training and bring that to the sandbox to teach yourself. Obviously, we will have instructors available online at that time. So those are two sets of cloud computing opportunities on research and training. I hope you look into that. Next, please. And finally, I want to draw your attention to a new funding program we launched about a month ago. So the program, we call it SURE, or Support for Research Excellence. The program really is a redesign of a long-standing program known as SCORE, okay? Many of you probably are aware of, but without getting into the details, the goal of the objective of the program really is to develop and sustain research excellence at under-resourced institutions, meaning receive no more than $6 million NIH funding each year, that serve students of underrepresented backgrounds. And the mechanism is to support investigator-initiated research. All right, so the eligibility basically have two critical sets. One, as I mentioned, is the institution have to receive no more than $6 million NIH funding. The second one is that this is where we introduced the innovation or change to the previous program. Is previously the SCORE program requires applicant institutions submit 10 years worth of student enrollment record to establish your own eligibility. That's a heavy burden, and even you do that, you don't know if you're eligible. So we changed that to use publicly available resource. That is the National Educational Statistic website. You can go there, find how many of your students received Pell Grant. If you receive more than, if 25% of your students receive Pell Grant, your institution is eligible. So now that many, especially the inbreed leaders, I know that you work very hard to help the POI investigators to compete for R15. So this actually looks a whole lot like R15, right? Except that you check with the Pell Grant. And my assumption is, I want to emphasize the Pell Grant, a lot of our, the inbreed network include 370 institutions. Most of them are POIs. A conservative estimate will be the majority of those institutions will meet those criteria. So I strongly encourage you to work with your POI leaders and POI investigators to look into the new SURE program. All right, next slide, please. So those are the three funding mechanisms of the SURE program. The first one we call SURE Award. That's basically for rank and file faculty investigators, for everybody. And the second one is for new investigators. And the third one is something new. We found that to address a specific need. So we're going to found a nationwide resource center. The resource center will do a few things. One is going to sponsor pilot program to specifically support smaller institutions to either build or strengthening their offices of sponsored programs, so that enable them have a stronger capacity to submit grant applications to help investigate. Second thing is the resource center will together will have regional outreach coordinators together with their center staff to conduct training and informational outreach to both the applicant as well as the Office of Sponsored Programs staff, right? And finally, the resource center will track the institution's growth in research capacity and its own service, just to see how efficient their service will be. Next slide, please. So with the effort I just described, we anticipate a significant expansion in the program. So how do we finance the expansion? Here is the two-step plan, right? The first is that NIGMS will at least maintain its current support to the program, which is about $40 million per year. Second is that we secured or enlisted at least 15 other NIHICs who will help fund meritorious applications that fall in their institute's mission areas. I should have said that the SURE program, unlike other NIGMS programs, it just like IDEA, is support research that from all NIH mission areas. So is going to be a much broader opportunity for applicants. Next slide, please. So before I wrap up, I just want to share with you that over the last year, we put significant amount of effort and resource to rebuild our website. A lot of the things that I talked about, if you look at our website, you probably can find them. And one particular feature on our website is the IDEA interactive portfolio dashboard. So you go on to our website, you will see that basically you can see all the currently active IDEA awards, COBRI, IMBRI, CTRs, anything, right? It has been for all the people who have been used, they all liked it very much, very, very helpful. Next, please. And finally, I want to say, we also recognize that everybody is so busy and that everybody is being bombarded by information. So we made an effort to send out a half-pager update every Monday afternoon to all IDEA PIs. Basically, our objective, like to hear your feedback, is to keep everything short, but provide you the information most relevant to the IDEA community. The opportunities, funding opportunities, or other opportunities that you can take advantage of. So with that, I'll be happy to answer questions.
Thank you, Dr. Lee, for very informative information that you delivered on multiple programs. And I think great opportunities across the board that are coming through. Elijah, maybe we could get the executive committee of NAIPI unmuted, and then they will facilitate, they could ask the first set of questions, and we will also have them facilitate the Q&A session. Please post your questions to the chat box, and then we will be able to ask the questions to Dr. Lee. Part of the issue is we have over 240 people that are attending this meeting. It will be very hard for us to track who may be raising hands and wants to ask a question at this point. The session also is recorded, and the slides will be available through the NAIPI website. So maybe I could ask the first question, Dr. Lee. Obviously, there are many opportunities that are coming through. I wonder whether there are also any updates on the SBIR STTR program, whether the IDEA program can be leveraging those programs. I know there was some interest in that, but we haven't got an update on that.
Leveraging, meaning if you mean collaborations?
Yeah, I mean, obviously there's seed funding through the hubs, but I wonder whether the NIH is thinking whether SBIRs, STTRs submitted through the IDEA states may have an IDEA leveraged position to be funded.
There is no, so the SBIR, STTR is a separate program, right? And there isn't like a SBIR IDEA program per se, right? But certain institutes will recognize the need or diversify their portfolio, give certain leverage to IDEA state. But there's no mandate, to be clear, to answer your question. Right? From our standpoint, is we strongly encourage collaborations. We also, the goal of the hub program obviously is to assist our investigators to in their applications. So one of the tangible measure for the success of the hub actually is the increase in SBIR applications from the region. So actually, this is a good opportunity for everybody to be aware what the hub is about. The primary mission of the hub is to provide educational outreach, provide resources, provide expertise. And so I encourage everybody who have an interest in SBIR, STTR, reach out to your regional hub to get their assistance, right? That's their job. And I think they're going to be happy to work with you.
Great, Dr. Lee, thank you. We have a number of questions related to the Sure program. This question is from Dr. Darren Atkins. And he says, hi, Dr. Lee, the old SCORE program now revamped as the Sure program looks awesome. Sure is aimed for developing and sustaining research. Can you mention a bit more on how Sure will sustain research for both institutions and for funding PIs?
Thank you. That's a great question. So one of the major issues during the program evaluation of the old SCORE program is somehow it sort of little bit get away from what the main objective. The main objective is to build those under-resourced institutions. But the old SCORE got to a point that have a very heavy emphasis to develop and graduate investigators into R1 grantees. And lo and behold, that is not a good goal, not a good approach, and not successful approach. So while the SCORE program spent a large portion of the resource on that regard, the outcome was poor. And also, it does not sustain the research excellence in those institutions, is because those programs, once you get a non-SCORE grant, you're no longer eligible for SCORE. That was disruptive. So in the new program, we reverse that. Okay, the emphasis is not graduate the investigator into R1 grantee, but is the excellence is measured by quality publication, by student participation, and so and also when you have a need, regardless you have at any given point you get an outside grant, as long as we all run into that problem, right? Your R1 had a gap. When you had a gap, you are eligible to the SURE program again. So in that regard, we provide the means for investigator to sustain his or her own research program for the long run.
Okay, great. Let's continue with a few more questions on the SURE program. From Jerome Sainz, the question is, would it be advisable that SURE eligible institutions seek formal or informal partnerships with universities that have IMBRI and COBRI awards?
So interesting question, but I want to say that SURE awards are investigator initiated grant, just like R15. So in the end of the day, the investigator is in the driver's seat. You have to leverage, get help from your institution, from the sponsored programs office, but it's not an institutional grant. So on one hand, we encourage you to collaborate, especially in IDEA state, to collaborate with our IMBRI network, but we haven't really fully explored the institutional type in that regard. But I hope, as I said, one of the reasons I'm talking about this here, I think, is for our IMBRI leaders. This is the opportunity for you to help bring the PUI's awareness that this opportunity is here for you. As far as application is concerned, the burden is not higher than R15.
Thank you. A few more questions from Jose Rodriguez Mendina. He's asking, will the number of SURE awards per institution be capped as it was with the SCORE awards?
The answer is yes. The cap, I think, remains 20. If you have any institution has reached 20 SURE, you have to take a break. So, but our internal analysis is that nobody's near that threshold at this point.
And a few relevant questions, and then we'll switch to Doug Wright to pose some other questions as he chooses. So one question is from Cheryl Josic, is can an investigator have an R15 and an R16 at the same time?
If you start with R16, you can and you're encouraged to apply for R15, right? But if you start with R15, no, you're not eligible for R16. Remember, this is a special program designed to meet the special need of this set of institutions. So if you have a R1 or R15, you're no longer eligible for R16.
And the follow-up question from Dr. Sharma is, the SURE program looks great. Can the investigators who just graduated from an IDEA program, I presume PUIs, can be also applying now for a SURE program? If
Absolutely.
They're really, yeah.
If this is related to what I said earlier, a lot of your effort have been encouraging the recent graduate of IDEA program to apply for R15, right? Here we go. You have both R15 and R16 to try. Okay,
Doug, Dr. Doug Wright, you could take on from there, please facilitate the Q&A session. And I think you have a question to ask.
Certainly. Hi, Dr. Lee, good to see you. One kind of specific question or suggestion, we appreciate all of the new supplements that are coming to us, but one of the things that we're finding is that within the FOA, the eligibility requirements for submission have a tendency to be fairly restrictive. And so we've had a number of opportunities where investigators in our state would like to apply for these opportunities, but the FOAs are very restrictive sometimes in terms of pilot grant or other sort of award winners. And I'm not sure who sets those eligibility requirements. I would ask that is it possible that we can broaden those such that we can include those? And part of the reason is that those investigators related to the supplement are not associated with the theme of our particular program. So we're missing out on opportunities for submission.
Okay, so first of all, I want to say that I wonder if you're referring to the IDEA supplement or supplement overall.
Oftentimes there, for example, the maternal or the vaccine hesitancy issues there, it's defined within the FOA that it has to be, if you're going to apply through this INBRI program, you have to meet these requirements. And so we've had 5 or 6, instances where people reach out to me and say, I want to apply for this. This is great, but because it's the way the FOA is written, they're not eligible to submit through us as well. And so I would love to see that broadened so that we can incorporate that and include those folks.
Thank you. I think that's a very, very important question. One of the phenomena you all observed is during this pandemic, there are lots of supplements. Why there are a whole lot of supplement? One of the reasons is, as I mentioned earlier, during this public health crisis, you want to leverage existing resources, platforms. So the shortcut is to use current award, right? So, but the flip side of the token is that supplement to current award itself is already a restriction. It's just certain restriction just comes with that. So that is sort of a general, just a point to make. But for IDEA program supplement, so I can share with you, for my principle is within the boundaries of the IDEA program, we try to be as inclusive as possible. So you see the our supplement, the INBRI supplement, the surveillance supplement, and even the vaccine hesitancy program. I think as long as you have an IDEA award, you're eligible. But just as I said, because they're supplement, whatever the parent grant stipulation, the boundary is still remains. So like IDEA money, it can't go out of IDEA. So it has to stay with IDEA. But I totally agree with you, is that it's more restrictive. Administrative is more streamlined, it's easier, it's faster. But as I said, within IDEA program, that's, I can't speak for others. Well, I can speak a little bit for Radix Up because I help NIH run that. We try to make it as inclusive as possible. So it's a fine balance. And also related to another point you mentioned that, yes, we have a large number of investigators. How, readily available those opportunities for them, that's an issue, that's a challenge, because this is all the supplement, I would say 90% of them are more around COVID past year. So, but we try to, we still, for example, have the INBRI supplement alive, I always brag about that as an encouragement to everybody. If you check NIH grant success rate, not a single one beat the success rate of the INBRI supplement, because we try to fund as many as we can. So I encourage you all to take advantage of that.
I'm looking at the questions. There seem to be a lot of enthusiasm for the weekly updates, but I think sort of a bit of common theme is just to maybe if we can, find a way to get those out to other people, to program coordinators, and to make sure that everybody's getting these, because I do agree they've been very helpful in terms of the increasing number on this. So I don't see another question that's outside.
Doug, it was an early one from Steve Kotz that maybe we ask, the question was, do you anticipate any additional opportunities, special opportunities for studies of long COVID treatments, these latent things. Do you think there are going to be additional opportunities beyond what is already going on with COVID?
Okay, great. So before I get to the long COVID, I want to follow up on Doug's mentioning of the weekly update. Yes, exactly. We would much appreciate your help. We didn't want to build send to 1,000 people. That's, we want to send to our PIs. We want your help, especially for example, IMBRI and CTRs. Your award is network by nature, right? So we would like that you will forward that to your, for example, program lead, POI lead, so that, getting from you, there's a natural synergy there, right? So, but for everybody else, anybody, you felt that that's relevant, we would appreciate you sharing with them, because sending from you is also an endorsement, right? Because most of them work with you through you. So we will, from our end, as I said, we're going to keep our effort to make it short, to make it relevant. We, take out those cookie cutter stuff, so that to make this effective service to the community. But long COVID, the answer is yes. I don't think the long COVID single award has given out yet. So the effort has strong congressional backing. So NIH has running the program out of, I think the NIH LBI is the lead institute. So they published 2 ROA, they called the request for application, I believe. And those ROA actually received applications. While they're working on those applications, they published 2 more, right? So those are all focused on large cohort clinical studies. And as I mentioned, our CTR coalition submitted a very large application. And another aspect is also data, is sort of along the line we discussed, going into long COVID, the continued documentation and sorting out of the patient data is critical. So there will be opportunity coming. One resource to find update on that will be our weekly update. Anything new we'll capture there.
Great. I see that our treasurer, Ian Meng, has lit up. I don't know, Ian, do you have a question?
Yeah, actually, one quick question here. I'm wondering about these hubs. The regional hubs, they all seem to have a slightly different flavor to them. And I'm wondering whether you can actually work with a hub that's not part of your region. Is it okay to kind of reach out that way?
That's a very interesting question. I'll need to get back to you, but obviously, if you contact the Northeast hub, Jack Rader is obligated to work with. If you contact Doug White, he may be your friend, he may not be, so who knows.
Okay, any other questions that you may want to ask Dr. Lee at this point? I don't see any other ones coming in the chat box, but let us know. Anybody from the executive committee may want to ask a question. Please go ahead at this point. Well, I hear none at this point, so I think we'll conclude this town hall meeting. We had over 250 people that attended that peak. I know this probably the number is much higher because there are people that are doubling up and tripling up listening in. So it's been quite successful to reach out the audience. I wanted to reiterate again for NAIPI members. NAIPI members are all not only the principal investigators of the COBRIs, INBRIs, and other programs. Anybody who's funded by the IDEA is actually a member, whether it's a junior project in an INBRI, and also the coordinators. So everybody who is actually funded directly or indirectly through the NAIPI members, voting members of NAIPI, although only the principal investigators contributing a fee on a per year basis. At this point, I want to conclude this town hall meeting. We again thank Dr. Lee for a very informative session. I think
Guys,
so, yes.
Guys, let me interject because I caught Mary Cushman's follow-up on Doc White's question.
Okay,
Maybe
yes, please,
I
go ahead, yes.
missed an important point. The supplement, the question is whether they have to go to the current project leaders. I don't believe so. Okay, your COBRI still has to maintain its COBRI-like structure. In other words, the research fund cannot go to the PI. But it does not say that it has to go to the current project leader. You can have, newly identified project leader for the supplement fund. So if I didn't make that point clear, I hope I have corrected that.
And perhaps that's a good opportunity. It reminds me, Ming, about this special opportunities that came through for collaborative grants, right, between COBRI and INBRI PIs. And I wonder whether you want to mention this, and would that continue, and how do you see that?
Collaborate.
Those special opportunities, supplemental funding that put, COBRI and INBRI
Yes.
programs, Sttr programs.
Look, this is the third year. This is one of the things I started shortly after I got to the position, and we don't have a plan to stop it. So
that's fantastic. I know that you are really the inventor of that program, so really want to thank you, because I think connecting among the programs is very important exercise at this point. So I don't see any other questions. Would like from our IT people to everybody to make sure you go to the NAIPI website and register with your information. As I indicated earlier, everybody who's linked to the IDEA program is a member of NAIPI, not only the principal investigators, although only the PIs are the ones that really are responsible for paying a fee. Would like to hear your comments about NAIPI and what the NAIPI website and other resources that we may need to garner for you to explore. And I think this media of the Zoom link and the town hall meeting is a fantastic way to disseminate information, and we hope to continue this, inviting speakers to be able to address the NAIPI membership at large. At this point, I don't know if any of the executive committee members would like to chime in. Doug, do you have a comment? And we can move on.
No, just congrats on kind of getting us through this. I think all of us are eager to see where the NIH budgets land and where the IDEA program lands with this. And we're hoping that, we can provide you all the information that you can. And as I'm listening to you speak, I'm looking forward several years to see how some of the ideas that you're sort of laying out and some of the programs that you're testing here can be incorporated into the various INBRI and COBRI programs. And I would say I would have an ask that we continue to integrate the accelerator hubs within the existing programs. I mean, I think it's still a bit of a challenge as everybody has their own sort of agenda, and we as a hub would really like to integrate better with the COBRI programs and the INBRI programs across the states. And if NIH can help nudge that, I think that would be very much appreciated. I think that we'd really like to help, these programs, and the COBRI programs to me are wonderful little micro nests of entrepreneurship that could come out of that. So anything that the NIH leadership could do to sort of help boost those interactions, we would certainly appreciate it. I think that's, I look forward to the kind of working more closely with the COBRI programs in this, at least in the central region.
Good to know, Doug. We don't do nudging, we do facilitating.
Yeah. Well, you know, it's apparent that the IDEA program does a tremendous service to the nation because it engages the entire country into, you know, biomedical research. And I think we need to thank Dr. Lee, Dr. John Lors for being great supporters of this program. And we hope with NAIPI to provide advice and provide dissemination of information to facilitate biomedical research throughout all our programs. Thank you, everybody, for attending. Dr. Lee, thank you for your wonderful presentation, and we look forward to interact with you in the future.
Thank you. Have a great day.
Yeah. Bye, everybody.